Hi guys, welcome to our gross anatomy lecture. So today we're going to talk about the acromioclavicular joint. Let's take a look at the osteology of the clavicle. The clavicle is an S-shaped bone, which is a long bone, and only long bone that is horizontal, face to ossified with no medullary cavity. It is going to be articulating medially with the first rib and the manubrium of the sternum to form the sternoclavicular joint. Then laterally, it will articulate with the acromion, right, via the acromioclavicular joint. Take note of this. The acromion is an extension of the spine of the scapula that actually articulate with the acromial end of the clavicle. So, articulation, it occurs between the acromion of the scapula and the lateral end of the clavicle. This is a synovial plane joint. This was a synovial double plane joint. This acromioclavicular joint is a synovial plane joint. What does it mean? It means it only allows gliding movement to take place, right, during the rotation of the scapula. So, yeah, or when there is elevation depression of the clavicle, so there is gliding movement on the acromioclavicular joint. It also has a capsule. If you are going to look at it, it has a capsule, and this capsule, it surrounds the joint and it actually attaches the margin of these articular surfaces. Let's take a look at the ligaments. Well, it has two main ligaments, what you call superior and inferior acromioclavicular ligaments, that actually reinforces the joint superiorly and inferiorly. Between these ligaments and the caps, there's actually going to be an articular disc, and this articular disc, it actually extends from the superior, right, going to the inferior. The joint, since it's a synovial joint, is going to be lined by synovial membrane, and this synovial membrane, it actually lines this capsule and also these articulating cartilages of the acromion and the lateral end of the clavicle. The nerve supply, if you remember very well, this is a suprascapular notch. There was a nerve that was passing within the suprascapular foramen. What's the name? Is the suprascapular nerve. So this very same nerve, it actually sends some branches to this joint. So for nerve supply is the suprascapular nerve. Right. What is important is that the stability of this joint is mainly anchored by the coracoclavicular ligament. So the coracoclavicular ligament is a ligament that extends or runs from the coracoid process and attach the inferior lateral portion of the clavicle. It is made by two. You're going to have your trapezoid ligament that is posterior and attaching to the trapezoid line, and then you're going to have a conoid ligament that is a bit anterior to the trapezoid ligament, and together these ligaments, they actually form the accessory ligament of the acromioclavicular joint. So which means they are responsible for suspending the weight of the scapula and the upper limb from the clavicle. Understood? What are the movement? What are the relations? The movement, we already said that since this one is a synovial plane joint, it's going to be involved in gliding movement. In terms of important relations, what is anterior? So what is anterior to the acromioclavicular joint? Definitely we are going to have the deltoid muscle. Remember the deltoid muscle extending from the it has three origins, right? It's going to have a portion of it on the lateral end of the scap on the lateral end of the clavicle, then another portion from the acromion, and then another portion from the spine of the scapula. So the deltoid will actually be anterior to the acromioclavicular joint. What is posterior? Posterior, mainly you're going to have the trapezius muscle. The trapezius muscle, which attaches to the posterior lateral end of the clavicle. And then superiorly to the joint, well, there's only the skin. And remember, between this joint, there's going to be a muscle that is going to be, or there's going to be a muscle here, that's your subscapularis muscle. And then there's going to be a muscle that will actually pass behind this joint. That is called your supraspinatus muscle, attaching to the upper portions of greater tuberosity. So to prevent friction between this portion and the muscle, is you're going to have your subacromion bursa, which is a very important bursa that separates this joint from that tendon of the muscle. So there's also going to be dislocation of the joint. So take note of this. The dislocation of the acromioclavicular joint is actually going to be called shoulder separation. Why? Because it's going to separate bones that make your shoulder gidu, which is your scapula and your clavicle. So this happens when there is a severe blow on the point of the shoulder, right? Causing the clavicle to move superior or upward, or to elevate upward to your acromion, right? Because of the sternocleidomastoid of the clavicle. So the clavicle, its end is going to move upward and sits on the acromion. So this can actually be seen in clinical examination. So another important clinical correlate comes from the damage or tearing of the coracoclavicular ligament, right? So since the strength of this joint depends on the strong coracoclavicular ligament, which binds the joint to the coracoid process. So if there is a tear in this joint, maybe due to a fall on an outstretched hand, it can actually also cause shoulder separation. So thank you so much. This is everything I have for you today on the acromioclavicular joint. See you next time and take care.